Hey friends, welcome back to another video. So today we're going to discuss anticholinergic toxidrome, some of the causes of it, and then also we're going to discuss the treatment. Now I know this is in my opinion, a very common topic to get mixed up with cholinergic toxidrome, so I'll make videos discussing both, but I'll start with anticholinergic toxidrome. So let's go ahead and kind of get into it and break down what anticholinergic toxidrome is. So first of all, one of the kind of teaching points that I picked up on that I thought was very helpful for me for quickly being able to distinguish between anticholinergic and cholinergic toxidrome is think Alice. So anticholinergic, think Alice. And the whole reason for that is there's a pretty nice little list that you can remember what the effects of anticholinergic toxidrome are that are based around Alice in Wonderland. And we'll just walk through it right here and we'll discuss it really quick. So this is a very ugly image that I drew myself, and the whole purpose of it was to help demonstrate what some of the common effects of anticholinergic toxidrome look like, what it presents like, and hopefully this helps you. If not, well, it was worth the effort. So let's go ahead and get into it. So the top hat here, this is just to represent mad as a hatter, right here. And that is going to represent delirium and hallucinations that a patient might present with. Moving on to the sunglasses here. Blind as a bat, that represents mydriasis. Mydriasis is big, dilated, blown out looking pupil, okay? And the next, this is little orange here is supposed to represent kind of like steam coming off someone, and that represents hot as a hair. And the medical term for this is anhidrosis. So a patient, they will not be sweating. Next, the little red here, this represents red as a beet, which is gonna be a patient who's flushed. Moving on to the green here, this is supposed to represent someone whose ribs are visible, but this is gonna be dry as a bone. So if you remember, we discussed hot as a hair, anhidrosis, they're not sweating. They will experience antihydrotic hyperthermia. They will become very warm. And then finally, in the purple here, this is gonna represent full as a flask. So this patient will be experiencing urinary retention. And kind of to go along with it, patients who have overdosed on anticholinergics, they also will have decreased bowel sounds. And I think that makes sense. So you can't pee, you can't poop. Kind of the same thing there. So just remember this, anticholinergic toxidrome, think Alice, as in Alice in Wonderland, and think mad as a hatter, blind as a bat, hot as a hair, red as a beet, dry as a bone, full as a flask. I think that's pretty helpful in being able to distinguish what some of the common findings are in a patient who's overdosed on anticholinergics. All right, so next, very quickly here, I just wanted to cover what some of the common medications are that could potentially exacerbate anticholinergic toxidrome. So let's go ahead and discuss those really quickly. I think in another video I can go into more depth about this, but again, we'll just keep it very simple here. So first of all, TCA, this is gonna be your tricyclic antidepressants. So think your triptylines like amitriptyline, nortriptyline, etc. Next is going to be your antihistamines. So think about a patient with allergies. They're taking a lot of like diphenhydramine or hydroxyzine. These could be medications that also exacerbate anticholinergic toxidrome. Next is going to be muscle relaxants. So these are going to be like cyclobenzaprine or baclofen. And antipsychotics, this is going to be like your chlorpromazine, olanzapine, and clozapine. Then a couple other bonus medications are going to be meclizine and then dicyclamine as well. So just keep these in the back of your mind as potential causes of anticholinergic toxidrome. If you have a patient that takes a lot of medications, just consider these different classes. All right, and let's get into the final portion of the video here. And what this is supposed to do is just discuss some of the basic pathophysiology and the physiology of anticholinergic toxidrome, and then it's gonna help explain how the treatment works. Because I think it can be kind of tricky, especially when you're trying to differentiate between the two. It's like, well, what's the medication called? So let's take a look here. So on the left, what you'll notice, this is our parasympathetic neuron, presynaptic neuron. It's releasing the blue dots, which represent acetylcholine, and they are traveling from left to right, going to the postsynaptic neuron, which is the target tissue with the muscarinic receptors, which represent these little, the black right there, okay? And then also it's important to know that these little Pac-Man like green areas right here, right up here, this is acetylcholinesterase. Acetylcholinesterase is an enzyme that essentially breaks down acetylcholine. And the whole purpose of that is just to be able to balance the amount of acetylcholine, because like kind of the opposite of anticholinergic toxidrome, if you have too much acetylcholine, that can be a problem as well. And to break this down very simply, it's that the problem with anticholinergic toxidrome is that there's not enough acetylcholine going from left to right. So there's not enough going from pre to post. And that'll be an important distinction, I believe, when we cover cholinergic toxidrome. So remember, there's not enough acetylcholine reaching the target tissue. That is essentially the whole problem. Okay, so now that we've discussed that, so what is the treatment for anticholinergic toxidrome? I'll take a moment here and you can guess if you'd like. All right, now the treatment is something called physostigmine. Now how this works on helping this toxidrome is what physostigmine actually does is it inhibits acetylcholinesterase. So it's kind of a weird thing to think about, but the treatment is it inhibits the inhibitor, right? And if you move down to our synapse here, if you are inhibiting these little Pac-Men with physostigmine, what does that mean? It means that there is more acetylcholine that is making it to the target tissues. Does that make sense? So the treatment is you want to inhibit the inhibitor. You get rid of the acetylcholinesterase, the little Pac-Man looking things. You're getting more acetylcholine, making it from the presynaptic neuron to the postsynaptic neuron and into those target tissues. Well, hey, I hope that was helpful for you. Again, I'll make another video covering cholinergic toxidrome because, again, I think it's very common to get these mixed up. Please let me know if this was helpful. If you guys would like to see me cover a different topic, of course, please let me know. I actually haven't gotten another video request since posterior Chapman's points. So again, please like, comment, subscribe, and then drop a comment. Let me know what you want to see next. All right, thanks guys. See you next time.